Welcome to Eye Contact. I'm Henahan. With cataract surgery slowly but surely moving into the realm of refractive surgery, more and more patients are presenting earlier for surgery with softer cataracts. Today I'm speaking with renowned surgeon Dr. Soosan Jacob, who will tell us everything we need to know about dealing with these tricky cases. Welcome, Dr. Jacob.
Thank you, Sean.
Well, first of all, what are the basic challenges when you're confronted with a soft cataract?
You can consider soft cataracts in two ways. One, that it's hard, and one, that it's not hard. It just basically depends on the way you're going to deal with it. So soft cataracts can become more difficult to do if you don't deal with them in the right way. Now, the easiest way to deal with them is not to treat them as choppable cataracts, because they don't chop easily. What happens with them is when you go and try to hold it with a phaco probe, as you would do if you're going to initiate a chop, the soft material just gives way and comes off into the phaco probe, and you lose suction immediately. Similarly, when you're doing a chop, the chopper just slices through or cheese wires through the nucleus. It doesn't give you that clean cleavage. So these are things that can bother someone who's always used to chopping nuclei, and therefore the way that you approach a soft cataract is completely different.
Well, why don't we go through the steps, starting with the rhexis? Are there special considerations there?
Right. So, Sean, one of the very easy ways which I'll probably discuss with you in more detail than the others is hydroprolapse, basically for dealing with the nuclei. If you're going to use that technique, what you need to know is that your rhexis should be of an adequate size. If it's a very small rhexis, you may not be able to do that technique very easily. So, make the rhexis just so that you just get that overlap around the optic edge, so that you don't get PC opacification and there's a nice shrink wrap effect. But otherwise, it should not become too small. So, don't err on the side of a small rhexis. Now, once you've done the rhexis, the next step is hydrodissection and hydrodelineation. It's very important for soft cataracts to do a cortical cleaving hydrodissection, as to say, because you know that there's going to be a lot of cortex. You don't want to struggle with it later down the the way, and so you want to do this cortical cleaving hydrodissection at multiple spots and make sure that your cortex is freed up.
So tell us a little bit more about the hydroprolapse method, and then also how you're going to remove the lens.
Right. So, Sean, after the hydrodissection that I just mentioned, you need to do a hydrodelineation for the hydroprolapse method to work well. And what you need to remember is that you want to make that nucleus smaller. So, for this you're going to take the cannula and inject fluid into that space between the epinucleus and the nucleus, so till you see that nice golden ring. Now, how small you want to make it would also partly depend on how much epinucleus you want to leave behind. If your rhexis is large enough, you could possibly leave behind lesser epinucleus and include some of that epinucleus as well into the nucleus, so that all of it comes down fast and you're not having to deal with a bulky epinuclear layer later. Or if you think that your rhexis is a little smaller, you can keep hydrodelineating till you've brought the nucleus down to the smallest size. Now, once the nucleus is brought down to whatever size you feel is right, what you do for hydroprolapse is you take your irrigating cannula and you inject small amounts of fluid right there into that plane. At the same time, you are depressing the posterior lip of the incision and you are injecting small amounts, so that you have this gradual pressure build up behind one of the poles. So, you are doing it only at one side, on one side of the nucleus. And this small gradual pressure build up slowly prolapses that pole of the nucleus out of the back. Now, remember, you should not do too much of fluid injection. You should not do it at one shot continuous irrigation. You need to allow that fluid to also flow out, so that you don't get a capsular block and a nucleus drop. So, it's a multiple gentle repeated build up of pressure, also releasing the pressure at the same time, so that this pole finally prolapses out. Once you've got it out, it's easy to get the rest of it out, because it's a soft cataract. You just work with high vacuum, high flow rate, very minimal power, and you can get that whole nucleus out.
I'm wondering if femto laser would help at any stage, either in the capsulotomy or later on.
I think femto laser for a soft cataract would have just as much role as it would for any other case. You could do a capsular rhexis of the right size. You could do nucleus softening, where it's actually already a soft cataract, so you really don't need much of it. I don't think femto would have much role. What you also do need to remember that it might release more gas bubbles, so be careful when you do that hydrodissection, because you have to make sure that you…
Some people do think it's a contraindication.
Yes, so you need to make sure that you release that gas bubble before you go ahead and do all your hydrodissection.
All these steps, extra steps, take time. How much extra time does it take to do your soft cataracts?
Well, actually, soft cataracts go really fast. Actually, they go pretty fast.
Because you don't have to be cracking away at them.
Yes, absolutely. So you just hydroprolapse them, and then you use your phaco probe and remove it. You don't have to hydroprolapse it. If you want, you can hydroprolapse it completely into the anterior chamber if it's very soft. But if it's moderately soft, you can leave part of it in the new bag, and you just chop the other part and keep feeding it into the probe. So they go really fast actually.
And as far as training trainees, how does that go?
Well, there are two ways of training them. One is you start them with choppable cataracts. That's for those training centers who start off with divide and conquer or with stop and chop, or direct chop. For those trainees, you would want a cataract with some amount of nuclear sclerosis. In some centers, for example, in ours, we actually start the trainees off with soft cataracts, which is easy to hydroprolapse out and remove without using too much of phaco power. So in those cases, in those centers, you'd probably start out with a soft cataract.
Thank you for joining us.
Thank you, Sean.
For more information on this and related topics, please visit us at eurotimes.org.